Hello, everyone. First and foremost, I'd like to thank the National Collaborating Center for Environmental Health for inviting me to present this work. We really appreciate the opportunity to share our experiences related to the development of healthy, complete communities. I also want to acknowledge the individuals who advanced this work at Peel Public Health, including David Gillette, GIS specialist from our Public Health Intelligence Division, and Greg Kubita, his manager, Maria Mukhtar, the research and policy analyst who holds the land use portfolio on the built environment team in the chronic disease and injury prevention division, who developed this work. And this work really wouldn't have been possible without them. I also want to acknowledge staff and leadership from Peel Data Center who are involved in this work and the ongoing collaboration we have with our Peel Region Planning and Development Services colleagues. Now, in this presentation, what we're going to do is we're going to discuss the development of an evidence-informed framework on healthy development to support walkability. We're going to discuss Peel Public Health's collaboration with our regional colleagues in development to implement policies that support healthy land use planning and development. And then we're going to examine our recent built environment data, which helps us to evaluate these healthy built environment policies. And some things I want to recognize as important and valuable, but that I won't have much time to go deeper on, include the nature of collaborations between public health and planning professionals, the pathways through which we developed our own health assessment tool and supported local municipal colleagues in aligning or enriching existing tools or standards with our healthy development framework, and the technical details of the process through which we developed our walkability index. However, some of these topics have been discussed in other external presentations, and where relevant, I will highlight that with links a little bit later. All right, so getting right into some background to set up the conversation. Peel Region is a regional upper tier municipality with 3 local lower tier municipalities that include the city of Mississauga, the city of Brampton, and the town of Caledon. Now, Peel Region is located in the Greater Toronto Area, just west of the city of Toronto. Our population in 2021 was 1.45 million. And in terms of geography, although people may qualify Peel as exclusively suburban, Peel has varied community design, including highly urbanized pockets, suburban areas, and rural communities. And these were all developed at different periods, but I wanted to highlight that approximately 1/4 of all dwellings in Peel were built between 1961 and 1980, when design was generally considered autocentric and what many people would have seen as suburban design. Now, Peel Public Health is a health unit that is embedded within the regional municipality, which means that we are more closely linked to the municipality's infrastructure and land use development teams as internal partners. The work I'm going to talk about today focuses on a project out of Peel Public Health's Chronic Disease and Injury Prevention Division that in part was developed to address increasing prevalence rates of diabetes. In Peel, these rates have been consistently higher than the provincial rates since 1996 and up until our most recent published data in 2022. And at the center of this work is the role that our built environments play in creating the conditions for regular daily physical activity through active transportation, and the importance of regular movement in the prevention of common chronic illnesses like diabetes. I'd also like to mention that Peel Public Health has been engaged in work being done by the Novo Nordisk Network for Healthy Populations out of the University of Toronto, Mississauga, that shares similar objectives and goals related to chronic illness. And the mapping work we're going to jump into in this presentation helped to inform their initial report titled Current State of Type 2 Diabetes in the Peel Region, and specifically its chapter on the built environment and diabetes. Continuing with some background, I also wanted to describe the planning framework in Ontario. The diagram on this screen helps to explain this framework, starting with the Planning Act, which is the provincial law that establishes the framework around how planning in Ontario should happen. It requires municipalities to develop official plans and provides for tools like zoning bylaws. Now, the provincial policy statement sets the policy foundation for regulating the use of land and development in Ontario. And both of these inform official plans. So the former regional official plan, which is no longer in place since July of 2024, implemented the provincial planning statement at a high level and then guided these specific municipal planning policies that support local implementation through each of the local municipal official plans. These in turn guide the development of secondary plans, block plans, plans of subdivision, and site plans at the more micro level. And before we can discuss how we've been mapping walkability in Peel, I need to take us back about a decade to when we created Peel's Healthy Development Framework. So this framework was built off an extensive review of the evidence to identify the elements of the built environment associated with walking behavior and that are relevant to community design. It identified these 6 core elements of a healthy built environment. The first being density, which refers to the number of people or dwelling units and or jobs in a specific area. Service proximity, described as the distance between where people live and where they can access services, for example, public transport, neighborhood and community retail services, and the location of employment. Land use mix, or the range and mix of land uses, such as employment, institutional, and residential lands. Street connectivity, referring to community design where pedestrians have access to the most direct routes to reach their destinations. Streetscape characteristics, referring to well-designed streets that include facilities for pedestrians, cyclists, and transit users along the public right-of-way. And finally, efficient parking, or the balancing of types of parking available through actions that limit surface parking or reduce the supply of car parking while increasing the supply of bicycle parking. Now, building on the Healthy Development Framework here as a foundation, Peel Public Health also developed an assessment tool with specific design metrics for these 6 core elements called the Healthy Development Assessment. And this is the tool that the region uses to assess the health promoting potential of proposed development applications. And through this next slide, I'm going to describe the process through which we embedded the Healthy Development Framework in planning policy. So the former Regional Official Plan was updated in 2017 through Regional Official Plan Amendment 27, or ROPA 27. In this amendment, our health and built environment policies introduced the evidence-informed Healthy Development Framework into policy. Now, these policies represent the region's innovative approach to address the public health and built form challenges faced by our communities. And this approach is based on partnerships with each local municipality, the development community, and other interest holders to deliver developments that better align with the key principles of healthy development, design, and walkability. It is also aligned to the region's vision to achieve community for life and efforts to deliver healthy, complete communities. Now, the main objectives of these health and built environment policies are to, 1, assess healthy walkable design as an explicit consideration in land use development by making health assessments a required part of the development applications process. 2, to systematically apply healthy design standards through specific metrics. So for example, block lengths. And 3, to guide development proposals to achieve a greater health promoting potential by communicating the results of health assessments and identifying context specific improvements that could enhance walkability. For example, this could be the addition of a pedestrian path to improve access and walking time from the proposed residential area of a secondary plan to a nearby community center or school. And over time, through processes that bring local official plans into conformity with regional official plans, these policies became reflected in each local official plan. Now, I wanted to note that how the Healthy Development Framework has been implemented through these local policies is tailored to each local municipal context through distinct healthy development assessment tools that apply the broader Healthy Development Framework as one integrated but context-sensitive approach across the region and the local municipalities. So why are we talking about official plan policy and the requirement for development to undergo health assessments that apply the Healthy Development Framework? Well, in this presentation, we're going to be talking about our Peel Walkability Composite Index, which provides walkability scores from 1 to 100, and which was developed for the purpose of monitoring the implementation of our Healthy Development Framework and our health and built environment policies over time. And to achieve this purpose, we needed to identify and create baseline indicators that linked to our Healthy Development Framework's core elements. And these indicators needed to describe Peel's built form as it exists across neighborhoods. The 8 indicators that make up our Peel Walkability Composite Index were selected through an evaluation of 21 indicators identified across the Healthy Development Framework's 6 core elements. And these were reviewed for their relevance, simplicity, validity, reliability, data vintage, and data quality. A subset of 14 indicators that had sufficient scores from this assessment were then run through principal component analysis to account for collinearity across them. And principal component analysis is a dimension reduction statistical analysis that transforms several correlated variables into a smaller number of grouped variables, including only those that contribute the greatest to the overall variance across the index. And these are called principal components. The final indicators that were determined from this process were residential density, proximity to frequent transit, proximity to green space, proximity to food stores, proximity to community services and retail, and proximity to schools, as well as land use mix and housing diversity. And since that was just a very high-level introduction to the development of the Peel Walkability Composite Index, I wanted to share that you can access more information about the technical details of the process we took to create it in a published paper for the journal Preventing Chronic Disease, Public Health Research Policy and Practice, and also in an earlier webinar that we gave for the National Collaborating Center for Environmental Health. So as an overview before we jump into describing our most recent data update to the Peel Walkability Composite Index, our purpose was to create a set of indicators to evaluate the outcomes of official plan policies on health and the built environment from the former Region of Peel official plan that are now reflected in the local official plans of our municipalities. Our indicators measure the presence of built environment infrastructure and community design that supports active transportation opportunities for pedestrians. The indicators allow us to examine progress over time since they leverage census data alongside other data sets, and we can recalculate them every 5 years to monitor for changes. And our recent 2021 data update is the first recalculation of these indicators from their baseline in 2016. And this means it's the first comparison we can provide to understand progress made towards creating healthy built environments that support walkability. So all that context helps to set the stage to take you through our 2021 Peel Walkability Composite Index update. And if you'd like to, you can follow along using our Peel Walkability Composite Index comparison tool, which is published on the Peel Public Health Status Data website. And this graphic shows that through our 2021 update, we were able to demonstrate a slight increase in the overall Peel Walkability Composite Index score for Peel as a whole. This is an average increase of 0.4 to an average total score of 56 out of 100, reflecting moderate walkability across Peel. But what about the component indicators that make up the Peel Walkability Composite Index? In the next section of this presentation, I'm going to describe the changes to each indicator averaged out for the full Peel region geographic level. And although we won't have time for me to go into all the technical details, I'm also going to describe the indicator a bit further, provide some key information on the methodology, and describe some limitations as we look through the differences we've seen against our 2016 baseline in each of these indicators. Starting with density. So our gross residential density indicator measures the number of dwellings per square unit area, in this case, hectares. It's worth noting that gross density means all land area was included. And this is as opposed to net density, which refers to the number of dwellings when you exclude for parks, open spaces, and other non-residential land uses. Gross density is calculated using the 2021 census data. And in this case, we use the area data from our 2016 baseline to ensure that we were comparing the same geographic areas, since the geographic units in the census can change over time. Limitations with this indicator is that it captures a number of dwellings rather than the number of people or households that could reside in those dwellings. And overall, as you'll see on the screen, there has been a slight increase in the average gross residential density for Peel, leaving us with an average in 2021 of 14.85 dwellings per hectare. Next, let's take a look at all of our service proximity indicators that speak to access to services within a walkable distance. So first, our proximity to frequent transit indicator measures the percent of residents that reside within a 5-minute or 400-meter network walking distance to a municipal transit stop, or a 10-minute, 800-meter network walking distance to a higher order regional transit stop with frequent service. Now, this indicator methodology, we use a walking distance through the available pedestrian network rather than Euclidean, or as the crow flies, distance, which would be a straight line between where people live and where they're going. And this is used to calculate all of our service proximity measures to better account for real pedestrian walkability. The transit stop locations and transit stop service data were extracted from the General Transit Feed Specification dataset for Mississauga and Brampton, and they reflect a snapshot in time from Monday to Friday in September. And our update actually used September 2022. So we jumped forward 1 year of data from 2021 to 2022 to try and mitigate for the impact of pandemic-era lockdowns that severely limited public transit route operations and which took time to recover. And I wanted to mention that our frequent service here is defined as a transit stop averaging 15-minute headways during peak hours. So that would be roughly 4 or more stops within the hour, and 30-minute headways during non-peak hours, or 2 stops. And in terms of limitations, although levels of service are accounted for in this indicator, the proximity of a bus stop cannot account for the number of residents who will in fact use that stop as a daily mode of travel. And when we look at the data on the screen and see 2022 against 2016, we see that the percent of the population with access to frequent transit in walking distance has dropped on average 1.5%. This is one of the few indicators where we've seen a drop. And although we cannot identify concretely why this has happened, we're aware that the impact of the COVID-19 pandemic on transit service levels may still have impacted this indicator despite our efforts to offset the effect by using 2022 service level data. Our next indicator is proximity to food stores, which measures the percent of residents within a 5-minute or 400-meter network walking distance to, oh, sorry, I'm jumping ahead. This is actually our proximity to parks and green spaces indicator, which measures the percent of residents within a 5-minute or 400-meter network walking distance to any park or conservation area that either contains an active recreation amenity or so a playground, for example, or pedestrian infrastructure, such as a trail or path. Now, conservation areas that require paid parking were included in this measure, as payment is only required for automobile parking and not for pedestrian entry. However, paid entry green spaces, such as golf courses, are not included in this metric. In terms of limitations, I wanted to highlight that the metric doesn't indicate actual use or quality of the green space. And also the size of the park or green space is not accounted for. When we look at the data here, we can see that our percent population with access increased, with walking access to parks and green space increased by 1.1% on average across Peel, leaving us in 2021 with 79.6% of the population in Peel with access to these parks and green spaces on average. All right, so our next proximity indicator is proximity to food stores. And this measures the percent of residents living within a 10-minute or 800-meter network walking distance to a food store. In terms of the operational definition of food stores for our indicator methodology, we reused the 2016 definition for consistency and data comparability. And this definition was adapted from Kristen Larson and Brian Cook's healthier food retail definition, and is defined as a food retail establishment that is open to the public and was classified in our public health inspector Peel Food Check database as a supermarket, a food store, that means a convenience or variety store, a multi-unit food store, and that meets one of the following criteria. And those are sells a significant quantity and diversity of fruits or vegetables, or specializes in or focuses on the sale of one category in Canada's food guide, for example, fruits and vegetables, grain products, milk and alternatives, and meat and alternatives, or does not sell calorie-dense, nutrient-poor foods or beverages of any kind. In terms of the classification methodology, stores that were categorized as yes in the 2016 version were carried over to our 2021 data set and included as already meeting the definition of grocery store or food store. However, even for these records, a manual check using accessible online information was completed to understand if the store still contained compatible uses with our definition of a food store, and if the store continued to operate or had closed. The other food stores in our Peel Food Check database were also checked manually through online tools to validate categorization and inclusion in the dataset for this indicator. And some limitations I wanted to point to with our proximity to food stores indicator was that we were generous in our interpretation of applying the inclusion criteria for food stores. And that was given the purpose of the indicator to measure these sites as generators for potential pedestrian trips, rather than a purpose to provide a definitive classification of each food store in the data set. And although we used a specific definition and categorization process, this may not precisely define the types of outlets we were interested in, like grocery stores. I'd also like to highlight that the indicator can have a high degree of subjectivity in the classification process. So this was managed by 2 independent reviewers performing classification, with a third brought in for disagreements. And now looking at the data on the screen, we can see that the population with walking access to food stores increased between 2016 and 2021 by 6.3% on average across Peel, to have 60.8% of the population with this walking access to food stores in 2021. And before moving on, I'd like to also highlight that we were made aware of research done in Southern Ontario that suggests across several communities, food stores, like grocery stores, were more likely to have maintained operations through the COVID-19 pandemic when compared to other food retail types, such as restaurants. And this was documented in some work in the Fresher research project led by the Human Environments Analysis Laboratory at the University of Western Ontario. Moving along, our next indicator is proximity to 5 or more unique community and retail services. And it's a little self-explanatory, but this indicator measures the percent of residents within a 10-minute or 800-meter network walking distance to 5 or more unique neighborhood public services and or community retail services. And the facilities included in this measure are childcare centers, hospitals and health clinics, libraries, performance and cultural spaces, recreation centers, adult or senior care facilities, pharmacies, places of worship, restaurants, post offices, salons, gyms, cinemas, dry cleaners, among others. And when looking at some limitations with our update, again, with the COVID-19 pandemic, many retail and community services may have closed or relocated. And the data here may not fully capture this phenomenon, especially with restaurants. And there's also a possibility here with this indicator of undercounting. And with this, I mean, if an area is determined to have less than 5 unique neighborhood services within that area, but the actual services there reflect meaningful variations in the broad categories I listed above, they may each be important inputs for generating pedestrian trips. For example, if there are 4 salons that cater to different populations in one area, a children's salon, a barber shop, or a nail salon, or others, these would not be counted in our indicator as 5 unique neighborhood or retail services. And therefore, we may not be capturing the walking trips that these services could potentially generate in an area. All right, so looking at the data we have on the screen in terms of a change between our baseline and our 2021 update, we saw on average that the percent population with walking access to 5 or more unique community and retail services fell by 2.9% to 68.2% of the population with walking access in 2021. So again, this is one of the few where we saw a decrease in the indicator from our baseline. All right, so our final proximity indicator is proximity to schools. And this measures the percent of the population that resides within an 800-meter or 10-minute network walking distance to an elementary school, and the percent of the population that resides within 1.6 kilometers or a 20-minute network walking distance of a secondary school. And for this indicator, the methodology calculates distance from the address point provided for the school. However, multiple entry points were identified for schools through ground truthing. In terms of limitations, this indicator only includes data on Peel District School Board and Dufferin Peel Catholic District School Board locations. Private school locations are not added to the data set, and this is due to data on private schools and Montessori's, for example, not being systematically updated in the school's data set we had access to. And also the private school catchment areas do not rely on school attendance boundaries, and therefore there is a risk that the nearby population within walking distance is less likely to represent students attending these schools as they may live significantly further away. All right, so looking at the data on the screen, we see that in terms of this indicator and the percent of the population with walking access to schools, it's remained relatively unchanged when we compare our 2016 baseline to our 2021 update. And it's relatively high as well. So we have 86.3% of the population on Peel with this walking access to schools on average. All right, finally, let's take a look at our indicators related to land use and housing types. Starting with land use mix. So the diversity of land use, or our land use mix measure, it measures the relative proportion of 8 different types of land uses. And these are commercial, so office and commercial services, institutional, so government and institution, industrial, open space, that means green space, as well as low density residential, medium density residential, and high density residential. And we use the Simpson Diversity Index, which is calculated using the following equation, where the lowercase n is the area coverage of a particular land use type, and the uppercase n is the area of all land use types together for that area. And some limitations we wanted to point out are the calculation of the Simpson Diversity Index will not account for access to different land use types along regional borders. And this is sort of an edge effect that we have with our tool. And it's because we don't have access to the data for non-Peel municipalities around land use. And I also wanted to highlight that with this index that we use as our indicator around land use mix, there's really no ideal proportion of land use mix that we can point to that would contribute to complete communities. And therefore, it can be hard to understand how the Simpson Diversity Index score translates into the real world representation of a walkable environment. All right, so the next indicator we are looking at is the diversity of housing stock indicator, which measures the percent of dwelling units that are classified as medium or high density residential units in a community. So these are classified as medium density and high density residential land uses in the census. And medium and high density dwellings include town or row houses, low-rise apartments 4 or less stories, and high-rise apartments 5 stories or more. And this indicator is calculated by dividing the total number of multi-unit residential dwellings, so again, row houses, high-rise apartment, low-rise apartment, within the census tract by the total residential dwellings in the census tract. And the indicator here cannot provide a measure of the percent of only single detached and semi-detached housing units within the area that's been assessed, or the total mix of existing housing in that area. All right, so looking at the screen here and looking at the diversity of housing stock data, we saw a slight reduction in multi-unit dwellings on average across Peel. And that was a reduction of 0.2% to a total score of 33.1% multi-unit dwellings in 2021. All right. So this brings us to what we've done with this data, which is create an interactive Peel Walkability Composite Index tool called the Peel Walkability Composite Index Comparison Tool. And the graphic on the screen here is taken directly from the online display of our Peel Walkability Composite Index Comparison Tool. And the comparison tool allows you to select by indicator by clicking on the bottom tabs you'll see. So you'll see residential density, frequent transit, green space, and others. And you can also select by municipality or even by individual census tract through the tabs in the top right. You can also use the lasso tool that is in the top left of the map on this screen to select a specific grouping of census tracts together. So although we've talked today about the overall Peel level PWCI scores and the scores of the individual indicators at the Peel level, the tool allows you to zero in and look at changes at multiple smaller scales that are more neighborhood or community level. And the multicolored bars located between the map and the indicators tiles reflect the breakdown of the proportion of the population that lives in each quintile. The light brown reflecting those census tracts that have the lowest walkability, and the deeper green near the bottom reflecting the proportion of the population that lives in census tracts, the highest scores for walkability. And as I mentioned, overall, we see a small increase in the Peel Walkability Composite Index for Peel as a whole. So again, this is 0.4 increase to a total of 56. I'd also like to note that there were increases in the Peel Walkability Composite Index seen for Brampton and Mississauga, but we saw no change in the score for the town of Caledon. And so I wanted to talk a little bit at the end of this presentation about next steps and how we use the tool. So the built environment team at Peel Public Health actively uses the data at the census tract level and other levels as we review plans and developments. And we've also used this data in collaboration with partners to identify neighborhoods for projects and interventions related to community design and chronic diseases that are associated with inactivity. And we're looking now to our next update, which would be in 2026. And this is given the assumed impact of the COVID-19 pandemic on some of our component indicators, and also given the time it takes for developments to be physically built, which would suggest that our next update is more likely to reflect the influence of our health and built environment policies and the healthy development framework that the Peel Walkability Composite Index speaks to. I wanted to flag that we have other mapped data products, including our Peel Health data zones, which provide map data for sociodemographic variables and health outcomes like chronic illnesses. And I know we're coming close to time, so I'm happy to end the presentation here and respond to questions. Or if we'd like to, I can open up the Peel Walkability Composite Index comparison tool and just show a bit more detail there. All right, so as you can see here, we have all of Peel and a number of our census tracts. And the whole map is interactive. So I was just talking about these quintiles that are located kind of in the center of your screen. When you hover over them, you get the population that lives in that particular quintile of walkability. And when you click, what's really nice is it zooms in on just those areas that are represented in the quintile. So you can get a breakdown of the different levels of walkability, where they're located across Peel by quintile. And as I mentioned at the beginning of the presentation, We have rural communities in Peel as well. So you'll see here that in terms of our lowest quintile, as we would expect, the town of Caledon, which contains our rural communities, has the lower walkability. And I think you can understand potentially why based on the indicators we discussed here today and that I took you through. I'm just going to jump quickly into our access to green space indicator. So here, as I mentioned, at the bottom of the screen, you can click by component indicator from the PWCI to get a little bit more information. So each of the tabs on the bottom will pull this up to give you a bit more info on the population with access, the changes. It gives you both the count of the population and the percent of the population. And then again, you have a breakdown of quintiles. So this was one of our higher scoring indicators. So the spread of the quintile will be a little bit less. But here we're looking at those areas in Peel that have the highest walking access to green space. And maybe I'll just highlight that if I didn't get to cover it in this presentation, each of these pages, when you go into the indicators, has a bit of a breakdown about what the indicator is, why it's important, how it's being measured, and some of the data sources just listed there below. So maybe I will stop there